Hello everybody, Alison here from Soul Sisters. I want to bring a different sort of episode to you this week. Unfortunately, my beautiful friend and colleague Denise was unavailable, so this episode is recorded solo. So it's just me, and I'm talking about a very polarizing topic. And I appreciate that there's very nuanced conversation around this topic that has split communities around the world at the moment. This topic revolves around the autism spectrum disorders, around my clinical practice and experience, and a different view. So I hope you enjoy this episode, and at the very least, I hope it brings a different view that perhaps you haven't considered before.
There was a mother who took her 20-month-old baby to catch up on the 18-month-old routine vaccinations, the measles, mumps, rubella, varicella shot. Within hours of this baby receiving this shot, the baby had a lump at the site of injection. It had a fever. It became very grizzly and grumpy and went off its food. The mum put the baby to bed. The baby woke up in the middle of the night screaming, blood-curdling screaming. She walked up and down the hallway with the baby all night long as it was screaming, screaming, screaming. She knew it was in pain until it fell asleep from exhaustion. The next day, this baby woke up again very grizzly. Thankfully, the baby woke up, but it woke up very grizzly. And was again refusing food, still had a fever, and now had red spots all over its torso and back. And when she looked in the baby's mouth, it had ulcerations all through the mouth, which would have been a continuation or a representation of also what was happening in the gastrointestinal tract. There was no question as to why the baby was A, in pain, and B, off its food. Its mouth hurt. Its guts hurt. Mum knew that this was all connected. She supported the baby as best she could. The baby developed very quickly a very deep, rattly cough. The baby looked like it had chickenpoxy spots all over its torso. However, it had just been vaccinated against varicella. Concerned, particularly with regards to the deepening respiratory cough that progressively got worse over the course of the next few days, the mother decided to take this baby to the emergency room to be assessed. The mother made one vital mistake. She mentioned in admission, in triage, that she felt that it was connected to the vaccine. So immediately, the attending physicians disregarded the mother, disregarded the child, said there's nothing wrong with your child, take your child home. She took the child home, continued to watch her baby deteriorate, this cough, wake this baby in absolute agony. The mouth couldn't eat because it was all ulcerated, this rash with pimply red dots all over the torso, back, and starting to go down the arms and legs of this baby. She knew this wasn't right. She was distressed. She returned to the emergency room. She didn't say during triage what had happened. She waited until the attending physician came to see the baby. The attending physician was concerned about everything that was going on, and when she felt that she had a bit of trust between her and the physician, then she mentioned that she thought it had something to do with the routine vaccination. And at that point, the doctor went away, had a discussion or did something, and then came back and said to the mother, there's nothing wrong with your baby, take your baby home. So she took her baby home, and at that point, she decided to go down another option. She booked her baby into a student clinic under a lecturer of hers, a lecturer who she trusted, in a naturopathic clinic. She told this lecturer what had happened to her baby. Her lecturer had also agreed that they were all connected, and they proceeded with herbal medicines to support this baby. Thankfully, the baby was out of the danger zone, but it took a long time. Now, first of all, I want to point out this story is not finished too, but I want to point out that if the attending physicians had been working under the model of science, they would have objectively collected facts so then they could make an appropriate diagnosis. However, they did not do that, and they judged the situation and sent the baby home, which could have ended in catastrophic circumstances. The mother also took her baby when the doctor's surgery was open again, because of course most of this happened on a weekend. She took her to the family GP, who had seen the baby for a long period of time, knew the mother, and knew that this was uncharacteristic. And the mother said, or informed the GP of all of the events leading up to this, and had also come armed with some research and some studies, so then she could have a proper educational, intelligent discussion with the treating GP. The GP was a very professional GP. She reviewed the literature. She agreed that it was plausible that there was a connection and that the baby might have had varicella pneumonia. The mother had learned through her connections and through this distressing period, which lasted many months actually, because the baby's immune system was completely ruined after that event, and it got very sick. This baby's behaviour changed. He couldn't sleep without laying folded over because his stomach hurt so much. He would wake in the night screaming, a blood-curdling scream. And for the mums out there with other injured children, you know exactly what that scream is, and it is blood-curdling. The only thing that can snap a child out of that is an iPad or a distraction of some description, and it brings temporary relief, temporary different distraction pathways in the brain that you're able to then temporarily soothe the baby. The mother had learnt of a vaccine reaction clinic at Westmead Children's Hospital, and she asked for a referral. Now, this Westmead Children's Vaccine Clinic, now this was well over 10 years ago. It was very not well known, and the GP hadn't heard of it, but she was very intrigued, and she wrote the referral. The mother took the baby. This is many months later, because it took all that long time to recover the baby, his health to a certain level, and to find the details that this mother was looking for. The baby was reviewed by a doctor at this vaccine injury clinic, and this doctor agreed that it was likely that the baby had suffered an injury from the varicella component of the vaccine. However, the recommendation was to continue to stay on schedule and to have all the rest of the vaccines in hospital if the mother was still worried. Of course, this was not an option for the mother. She had seen her baby very unwell and in fact was still recovering this baby's health. There was another mother who took her child in many years prior to have their routine vaccinations, and within a very short period of time afterwards, she found this baby unresponsive. And it was ruled that this baby had died from sudden infant death syndrome, or SIDS. We have since learnt very recently of a very similar condition called sudden adult death syndrome. And I'll let you draw the conclusions as to what the common denominator is within those scenarios. There was another mother who had a baby, and she and her husband were doctors. And of course, her baby went to every well visit and had every routine vaccination until one day the baby wasn't meeting the milestones and requirements of proper development, and that baby was diagnosed with autism. The baby regressed, was non-verbal, was in a diaper for many years to come, and the doctors chose a medical pathway. The doctor parents chose a medical pathway to support that patient, that child. There was another mother who had her baby routine vaccinated until she understood that her child wasn't meeting his milestone requirements. She took him to be assessed. He was also diagnosed with autism, and she, thankfully, like the first mother, was very good at putting in some non-conventional interventions, and she was able to recover her child, and he is now a grown child and participates in school and is a very smart child and no longer meets the criteria for autism. These are very, very common stories. And as you can see from those examples, there's very different outcomes. There is injury that results in immediate degradation of the immune system. There is death, sudden infant death syndrome. There is absolute regression and severity of injury to the body and brain. And there is similarly very regressed behaviour, injury to the body and brain. However, with the right attentiveness and care, the first and the last mother were thankfully able to regenerate and recuperate their children. It's not always the outcome though. Sometimes the injuries that occur to these children are extensive and you can recover some behaviour and you can't recover all behaviours. But at least you can reduce the inflammatory pathways that are occurring within the body and increase the quality of life that these individuals have. Over the years, the mothers and the fathers who have had children in the very severe categories have been completely shunned. They've had to live in silence. They've had to, and even the ones without super severe. So the first parent, for instance, was so concerned she presented to the emergency room twice. And as soon as that vaccine word was mentioned, the doctors switched off and said there's nothing wrong, even though there clearly was. Thankfully, the first and the fourth mother had the resources to be able to think outside the box and to find people to help them detoxify their baby's systems in their bodies and to give the appropriate natural medicines for the individual presentations. Left unchecked, all of those children would have been categorised on the autism spectrum. The autism spectrum is actually really vast. You can be a very highly functioning individual and have autism. You can have a very well-respected position in the community, a profession, and really be a brilliant contributor to society and still be classified as having autism, because the Autism Spectrum Disorders is a very broad spectrum. At the other more severe end of that spectrum, you have the non-verbal individuals who are in so much pain. They physically harm themselves because it's another stimulus to the body. They often are not toilet trained. How can somebody think about all of those things when their neural pathways are completely inflamed and shut down? Their anxiety is through the roof. Their digestive systems aren't functioning properly. Normal systems within the body that somebody on an ASD1 diagnosis might take for granted isn't working right for a severe ASD3. Do I agree with the classification of that entire spectrum? No, I don't. And in the last week, we have seen a perfect example as to why that classification system is not appropriate. Because we have highly functional, and that's an old term, so I know that people aren't comfortable with that term. However, I'm just drawing examples, right? So I'm going to use that term. Compared to somebody who is nonverbal, who requires a lot of assistance, you are low needs, low assistance on that scale. So by old terms, you are considered more high functioning than a severe ASD3 member of the community. And in the last week, we have seen potentially the ASD1 and the ASD2 part of the population who have a voice in the community. They're very active parts of the community. They are the community, right? They're there. And they have that voice. And so they can express the detestment of the language that was used by Bobby Kennedy when he got up in his press conference to talk about the more severe end of the scale. Now, for a moment, I want you to cast aside your own diagnosis, because it's brilliant that you're watching this video and that you can comprehend this video. That's amazing. But there is a section of our population that sit on the severe end of this spectrum who can't even watch this video, who can't comprehend it. Their carers are looking after them, and their carers are probably looking after this video. And it's that section of the population that hasn't had a voice, that has been shunned even more than what you have been shunned. I understand this is not easy. And again, I don't agree with that ASD 1, 2, 3 categorization. You are all really special, beautiful, brilliant people. You all bring amazing gifts to this world. And you all have a different story to tell. Bobby Kennedy was discussing the very severe end of that spectrum, and it doesn't mean that that was labeling you. If you have followed my page for a long time, you will know that I don't support labels. I don't support categorizing people for multiple reasons. One of those reasons is that's then what you define yourself as, and it's what community and journalists and politicians and people out there define you as. And in my opinion, that's bullshit. Yes, we need diagnostic criteria. We need it to be able to tick boxes and give you supports where you need them to help you improve your quality of life. However, when we become that label, when we become that diagnosis, it restricts our potential. Now, I have spoken with many people on the spectrum who appreciate the diagnosis when they're at that ASD 1, 2 level. because it helps them make sense of the world and to understand why they are different and why they didn't historically fit into the box. And if that empowers you, that's brilliant. It's amazing. That's wonderful. But there's a huge proportion of society that does not empower, it disempowers. You get looked at as somebody with a disability. You get looked at as somebody who's not neurotypical, and I'd actually even argue what is neurotypical. We all have our perks and quirks, but we live in a world that systematically categorizes people, it labels people, and it's a little bit too much up here rather than down here. We need to come to a point where either A, as part of an autistic community, you realize that there are people in all spectrums, in all ranges of that spectrum, and that we're going to look out for all ranges of that spectrum. We need to get to the point where B, those things don't define us, but they help us then to understand ourselves if it does help you in that way, and to navigate a world. Now, this has been a very interesting discussion over the last few days, in particular because I've even been watching some discussions in naturopathic forums where a lot of practitioners, again, highly valuable members of society. You don't have to be a practitioner, by the way. You could be a teacher, you could be a grocery store checkout assistant, you could be anything you want to be or anything that you are. It's all acceptable, it's all fine. But you are active members of the community. And that is my point. Yeah, you are active members of the community. Very valuable members of the community. And there was an interesting comment in this forum that said, we are born with autism. And I want to speak to this because as we reflect on some of those stories that I started this conversation with, those babies weren't born with autism, but they did regress. What made them regress? What made such a marked shift in their behaviour, in their health, in their well-being, in their quality of life? What did that? Environmental things triggered that. I'm going to put that in a different way. So we have for a long period of time been told that autism is a genetic condition. I would argue that it has genetic traits and that our environment allows that genetic characteristic to be expressed or not to be expressed. There's a beautiful field of science called epigenetics. Dr. Bruce Lipton coined that term, and it's a brilliant term. It helps us understand that we are not our genes. Our genes are part of us. However, our environment is what pulls the trigger on the loaded gun, per se, to express those genes. Now, speaking for myself and from my professional career, I worked in radiation oncology, which is cancer care, for well over 10 years. And I was born into a family that was predisposed to cancer. Now, should I go around saying I was born with cancer because I hold a certain genetic variant? And some of you may know this variant, BRCA1 or 2, BRCA gene. No, it doesn't mean I was born with cancer. It means I was born with the gene and something in my environment triggers that gene to be expressed. We know those triggers now. It's a very broad umbrella, but they're called carcinogens. Something that makes or triggers the genes to become carcinogenic, to express that. Now, when we pull that back into the autistic picture, you may have a particular genetic predisposition to being autistic, and it takes something in your environment to trigger that genetic expression. Is that glyphosate on our foods? Is that the vaccine schedule when your immune system is completely immature before the age of 3? Is it mold exposure? Is it other genetic pathways that are contributing to elevated homocysteine and reduced ability to make antioxidants in your body? There is a plethora of things in our environment that can create the triggering of our genetic makeup to turn these things on or to turn them off, which is why when we see someone with a diagnosis of autism, that gene is potentially turned on. And when we see somebody that had autism that no longer meets the criteria, we can assume through data as well as clinical experience and personal lived experience from many, many families around the world, that they have eliminated certain environmental triggers which have reduced the internal inflammation or the pathway congestion within the body. And now the baby, the child, the individual has lost their autism spectrum disorder diagnosis. They don't meet the criteria anymore. So isn't that a good thing? I think it's a great thing. I think it's really good to learn more information about what our environmental triggers are. And we know that autism spectrum disorders have been around. It used to be 1 in 10,000 kids that were diagnosed with such a condition. And now, if we're going to take the extreme in California, guys, what are you doing? 1 in 12. 1 in 12. Over 50 years. That's not a genetic expression. That's an environmental trigger. And Bobby Kennedy is the first person to stand up at great cost. I guarantee it's been at great cost for him over many, many years to speak about something so controversial, to bring light to the families at that severe end in particular who everyone's forgotten about, because we don't see those kids in society that often, or the adults, right? They're adults now. We don't see them in society very often because they require so much assistance, and it can be dangerous to the very severe end of that spectrum to be outside of a controlled environment. So we need to have compassion for all ranges of the spectrum, and I've definitely got compassion for the individuals at the ASD 1 and 2 level who have felt hurt by some of the remarks in the press this week. However, just asking you to consider the fact that he wasn't just talking about you. He was talking about your brothers and sisters at the very severe end. And no, that severe end doesn't categorize you as disabled, or because we know that you're very active members of society. But you also have very real challenges that you all need support with. And so this is where naturopathy, natural medicine can be of great support to people. And something I do in my clinic is I collect all those facts, right? The labels, the criteria, the diagnoses, the way you look at yourself, I collect all of that. And I make a picture of you, and I make a picture of the systems in your body, and we do tests to check that those certain pathways are functioning correctly, or if they're impeded, how can we open up those pathways? We check what the inflammation markers in the body are doing so then we can reduce the inflammation. We change diet and lifestyle. We change and we look for the triggers. Do you have exceedingly high heavy metals. Where did you get exposure from heavy metals? Was it from lead pipes in an old house? Or was it from adjuvants in a vaccine? Were you raised on a really inconsistent, unhealthy diet? And that just wasn't congruent with your genetic makeup. Were you raised in an environment that was completely unsafe, triggering, in combination with all of those other things? That's also going to affect your disease process, your condition. So this is where naturopathic medicine looks at the person, doesn't look at the label or the category. It takes it into account, yes. But the person that sits in front of me is who and what I assist. I do not blindly go off a diagnostic criteria, because that's not treating the person. I used to work in conventional medical care that was protocol driven and did not treat the person, and it wasn't congruent with the way I felt healthcare should be. So I became a naturopath so then I could do tailored individual healthcare. And if there are naturopaths out there that only go off a study because the data says X, Y, Z, and doesn't take the person sitting in front of them into account, I'd ask you to reconsider why, or have a think about why you actually came a naturopath. Because we treat the individual. Trauma should be taken into account. Emotional regulation and dysregulation. That's definitely a big one. Anxiety is a big one. That's a pathway. That's another pathway. We can reduce inflammatory factors that can absolutely, and there's multiple pathways, right? There's MTHFR, there's your dopamine pathway, your neurotransmitter production, your gut, the gut-brain axis, your vagus nerve. There's so many things, and different things are going to be triggered for different individuals. And whilst the medical establishment look at you like a set of criteria and boxes to tick, and they say potentially you were born like this, it might be time for you to rethink some of the messaging that you've been told. And again, I appreciate that this can be very discombobulating because there are multiple different highways that reach the same diagnostic criteria. Treating the individual is paramount to me. We work through meditation, we work through breath work, we work through the pathophysiological or the biological pathways within the body. We take into consideration, obviously, those diagnoses and the labels and how we see ourselves. And what has built the way that we see ourselves? Was it the diagnostic criteria? Was it society and their expectations of us? And we've got to break down those barriers. This world that we live in is a very systematic, protocol-driven world. And you're nature, my friend. You're a work of art. You don't fit in a box. There are aspects of that box that can assist you. Yes. Yes, there absolutely is, because that box is part of a collation of data from so many different other inputs that we're able to expand our knowledge and how this particular item might affect you or a certain environment for you. that, as we know, autism spectrum disorder is very broad and vast. So that box doesn't define you. It helps us to understand. And the discussions that are happening in the political arena at the moment are going to help us understand more. Dr. Seneff has been integral. She's a researcher out of MIT, and she's been very vocal for many years on the effects of glyphosate. Dr. Sherry Tenpenny, very vocal, very good at looking up vaccine correlations with this sort of presentation. We've got Dr. Brian Hooker. We've got, now this is a good one. Let's see if you can find the information. It used to come up first in the Google searches. Now you have to have to go through all the files. 2014, Dr. William Thompson. He was a researcher for one of the big pharmaceutical companies, who was literally, he became a whistleblower because he was literally locked in a room by the CEOs when they found that, people who had a particular vaccine did have a higher risk of autism spectrum disorders, in particular black boys over white boys at that time. And they were literally told to sit in a room, nut out the statistics until it looked better. And this wonderful doctor had a conscience and he couldn't deal with that. And he blew the whistle on that. And then, of course, you've got Dr. Andrew Wakefield from forever ago, who was a gastroenterologist, a medical doctor, who listened to his patient rather than looking at just a criteria. And all the mothers were saying, something happened in my child after their routine shots. Their guts hurt, they're this, they're that. And he had the audacity to propose more research into the connection, to see if there was a connection. And if you read his first paper, that's actually what he says. More research needs to be done, was his final conclusion. He was asking for people to look into it and to research it. His license was revoked. He was told that he was killing babies, and he never even made the statement that X caused Z. He just said, I've noticed a correlation. I have seen this. Can we study it further? Now, during the pandemic, we have also seen the silencing of medical personnel. Whenever there is something in the world where a group of people are silenced, violently silenced, you have to ask why that is. If we truly have everybody's interests at heart, we really should be fact-finding. We really should be analysing the data. And if it comes out that it's wrong, then it's wrong. That's great. We know it. Thankfully, though, we do have a lot of independent researchers. I have been looking into this for 13 to 15 years. There are published papers that draw very good evidence to suggest that vaccines, that glyphosate, poor diet, a range of other things, but those three in particular, and mold is another one, contribute to the severity of autism spectrum disorders. It's there. It's just not mainstream, because if it was mainstream, that would then obviously stop the sales of certain medications, pre-diagnosis or post-diagnosis. So these are discussions that the world needs to have. They potentially might rock previously held beliefs or messaging that people have previously been told. The main message I want to leave you with here today is genes do not mean that you have something for life. Depending on the damage or the expression of those genes, you may yes or you may not have a condition for life. Natural medicine offers a huge array of support for people on the spectrum. I have seen cases of full remission, and I have seen cases of improvement in quality of life. And in the cases where I haven't seen improvements, it has generally been because natural medicine requires you to do work. It requires you to change your diet, it changes your lifestyle, it changes your exposure to things, it changes your mindset. And I can understand that when you are unwell, that can be overwhelming. And so that's not a path for everyone, and I get it, that's okay. So as an example, I've got people that choose to just manage any health condition, but in particular behavioural spectral disorders naturally. And then I've got others who want to work in alongside the medical model, which I am more than happy to do as well, because at the end of the day, it's about the person that sits in front of me. It's about the individual. It's not about their label. It's not about their criteria. It's not about X, Y, Z. It is about them and their wishes. And that is what autonomy is in healthcare. It's not up to me to decide that as a practitioner. It is up to the person in front of me. So I had a patient who had become very unwell on their Ritalin and wasn't functioning anymore. We did the tests to find out which pathway was congested. We opened up the pathway. There were also parasitic and bacterial overgrowths in the stomach. We cleared that up and we had the good outcome that that patient wanted. They felt so much better. They could concentrate again. They could perform within a certain criteria in the education system. And their Ritalin reverted back to making them feel good rather than when they first came to see me, when they took their Ritalin, they were tired, they were nauseous, they felt numb. And when we opened up those pathways, when they then took their Ritalin, they felt good and they could think clearly and they were happy with that outcome. I'm happy with that outcome. They were happy. Their quality of life was reinstated. That is my job as a practitioner, to find something that meets my patient. I have other patients who bring their children to come to see me because the school has said, I think your kid has ADHD, I think your kid has autism, I think you're blah, 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 blah. And the parents are terrified. I don't want my child labelled. I don't want my child on medication for the rest of their life. Is there something I can do? And then that's when I ask them, are you prepared to make changes in your life? And if the answer is yes, then there's never any promises because nobody has a crystal ball. We say we can try these things. We've had success with these things. We can try them for your child. Would you like us to try those things? And often they say yes. And then we can, within a matter of months, sometimes when the child is young enough, in a matter of weeks, the parents come back and they say, little Jimmy has gone from being the class clown to being sent home to getting calls from school to getting the teacher's award. That is amazing. It makes my day. It makes their day. A bullet has been dodged. This world, whether you have a label or a diagnosis, is hard. If you've got that label or diagnosis, it can, not always, because sometimes it can be empowering, But in other times, it can make life harder. There's another obstacle. There's another self-identity, another program that we have to unravel. This world is hard enough, right? If those labels and those diagnoses help you in your life and they empower you, that is amazing. I applaud you and I support you, and you'll probably never set foot in my office because it gives you what you need, and that's amazing. But there are people that step into my office where that is restrictive and it's disempowering, and it's my duty, it's my job to help meet them where they are at. If that means I just get their child sleeping, that's a win. If that means I get their child to try a new food, which is huge, that's a win. If I can get their child to hold eye contact, and they haven't held eye contact before, that's pretty amazing. If I can get their child to go from a pathway where the teachers in the education system would have labelled little Jimmy, not his real name, and they would have said, this kid's he's on the spectrum. Little Jimmy's got ears, he's got eyes, he can see that he's treated different to everybody else. He knows who he is on the inside, but he's a powerless little kid in a system that labels and categorizes people. And then that sends that child down a certain path for the rest of their life, unless you've got a mother that says, maybe we can do this differently. Maybe we can empower him. Maybe I can change some things. Again, it's not a one-size-fits-all. Don't come at me with that. This is individualized medicine for individualized people, because we are not diagnostic criteria. We are not check boxes on a piece of paper. We know the brain is neuroplastic. It can be remodeled. Your gut sloths off its cells and rebuilds them every few days. The earlier we intervene and we start to remodel those things, the greater the outcomes are going to be. So the earlier you notice a change, the earlier somebody starts to say to you, this is happening, that's happening, I think you should get your child assessed. By all means, do all those things. Get your child assessed. But know that there is another pathway. There are other options. It maybe requires a little bit of work, because you're going to have to change your diet, you're going to have to change your lifestyle, you're going to have to find what the environmental toxin is, you're going to have to find what the behavioural belief is that's also contributing to these pronounced behavioural spectrum conditions. Anxiety, depression, sleep, a whole range of things. You are not black and white. I am not black and white. Nobody is. We're all part of nature, and we've all got our colour and flair to add to this world, and we all bring beautiful gifts. And actually, so if we look at ASD1, that used to be categorised as Asperger's, which back in the old day were, the people that could hyper-focus on something really beautifully and really bring it to life. And even if you don't exist within that spectrum and you have a really great interest area in life as a child, the schooling system is going to try and categorise you, because they only teach maths, English, science, history. And if you like marine animals, that's not in their education system. So you could be the best marine biologist this world's ever seen and not be on that spectrum, but that's just your interest area, and they could potentially categorise you because you sit in class and you're bored out of your brain, because the system that is the education system wants to shape everyone to be, at the end of the day, a productive member of society that can contribute to the economy, to be blunt. Whether you're on the spectrum or not, that is what the education system tries to instill in you, so then you can get a job, so then you can participate and earn an income. Again, whether you're on that spectrum or not. And it's a very in-the-box criteria. And if you're anywhere outside of that box, whether you've got a diagnosable condition or not, you will be labelled. Do we want to live in a world of labels and categorizations? If, like I said, if that empowers you, please be my guest. But there's a lot of people that disempowers, and I am very vehemently against it for those people, because how dare the world tell you what you are? You know who you are, and the work that we do together is about me listening, learning about your strengths, your capabilities, because you are very capable. There is something you can do that nobody else can do. And then we focus on bringing that out, as well as balancing those biochemical pathways, and just rechanging self-worth, all of those things. So if you have listened this far, thank you so much. And I appreciate every single one of you, and I also appreciate the diversity and the complexity of this conversation, which is why I don't post about it often, because it's not black and white, it's not cookie cutter, and I refuse to take an excerpt out of a study or a journal and paint everyone with the same brush, because everyone's different, whether you're on the spectrum or not. I hope that has given you a little bit of information, and at the very least piqued your curiosity about what things we could do different within our diet, within our lifestyle, within our environment. And that includes our relationships. If we are in a toxic relationship, that is going to create stress and inflammation within the body and contribute to the expression of additional anxiety disorders, for instance, or depression, for instance. If you're interested, book in with a naturopath that is open-minded, because there are a lot of naturopaths who work under practically a medical model, and I don't know why they didn't go study to be a medical doctor, because they've forgotten about the individual that sits in front of them. And that's it for me.